Bismillahirrahmanirrahim. Assalamu alaikum everyone. I am Muhammad Abdullah Ijaz and today I will be presenting a canine theriogenology case study titled as Neonatal Ingestion Misdiagnosed as Dystocia in a Bitch. This case was reported in the Journal of American Veterinary Medical Association, Volume 234, Number 2, January 2009. Moving towards the beginning of this case study, the case background was as the patient was a 4-year-old 17 kilogram Kishond bitch experiencing her first litter. The owner reported that labor began around 7 hours early, during which 8 pups were delivered, 4 alive and 4 stillborn. However, prenatal ultrasonography had previously detected 9 fetuses, and radiographs taken by the referring veterinarian suggested one fetus might still be retained. Because of this, the bitch was referred to a veterinary teaching hospital with a presumptive diagnosis of a dystocia, and dystocia is difficulty in parturition, possibly due to a retained fetus, and this is a much worrying thing for the owner. Then the clinical signs observed at the clinic on arrival of the bitch was bright, alert, and responsive. The normal vital signs, a temperature of 102 Fahrenheit, a pulse rate of 110 beats per minute, and a normal respiration characterized mainly by panting. Her mammary glands were engorged and producing milk, which is expected to be normal in the post-valving period. A serosanguinous vaginal discharge was present, which was also considered normal. No pain, abdominal masses, or abnormalities were detected on palpation. Overall, the clinical findings were unremarkable and not typical of dystocia. The radiographic findings were taken for comparison with those from referring veterinarian. Interestingly, the radiographs showed a mineralized fetal skull in the left cranial quadrant of the abdomen, located cranial to the spleen but surrounded by gas and ingesta. It means that it was inside the stomach, not within the uterus. There were no visible fetal skeleton parts attached to the skull, and the uterus appeared fluid-filled but consistent with normal postpartum involution. This finding led to a diagnosis of neonatal ingestion rather than fetal retention. In simple words, the mother had ingested one of her neonates, and what appeared to be a retained fetus was actually a fetal skull in the stomach. These are some radiographic evidences that we get from the case study, and you can clearly see the skull inside the abdomen of the bitch. This is one more clear radiograph pic, and you can easily see the mineralized skull of the fetus inside the abdomen of the bitch, and it is surrounded by ingesta and the gas. Then moving towards the management and outcome. The case highlights the importance of the radiograph's interpretation in reproductive cases. Because the fetal material was already in the stomach and surrounded by ingesta, no surgical or medical intervention was needed. It was expected that the ingested remains would be digested naturally with minimal risk of gastrointestinal perforation. The owner was consoled about post-valving behavioral changes, including the possibility of hysteria or cannibalism, and the bitch was discharged. Follow-up communication later confirmed normal behavior at home, with no further maternal aggression, and the 4 surviving pups were healthy and rehomed at 6 weeks of age. Then the diagnostic imaging insights. This case highlights the importance of radiographic interpretation in reproductive cases. Radiography is 100% accurate for detecting pregnancy and about 93% accurate for determining litter size. Fetal skeleton becomes mineralized around 44 to 46 days after the alleged surge, making late-term radiographs very effective for counting fetuses. However, when the objective is to assess fetal viability or uterine health, ultrasound remains the modality of choice. In this case, radiography clearly helped differentiate between a retained fetus and a stomach-embedded skull, preventing unnecessary surgical intervention. The behavioral considerations. Now let's discuss the behavioral side of this case. Post-whelming cannibalism or hysteria can sometimes cause a bitch to injure or eat her pups. This may occur due to the stress, dead or weak neonates, overexcitement, or environmental disturbances. Sometimes it can be related to hypocalcemia or eclampsia, especially in small breed bitches nursing large litters. This behavior is more common in first-time mothers, like the shown in this case. A bitch may also ingest a dead or malformed pup instinctively to promote hygiene and reduce predation risk. However, overexcitement or inexperience can also lead to accidental harm while cleaning the pups or biting through the umbilical cord. Now, the prevention and management of the behavioral issues. To prevent such incidents, it's crucial to provide a quiet, low stress environment before and after whelping. Minimize disturbances, limit visitors and noise during parturition. Avoid excessive calcium supplementation before delivery, as it can predispose to eclampsia. Closely monitor new mothers, especially primiparous or small breed bitches. If aggression is observed, separate the pups and consider fostering or hand rearing. Poor maternal behavior, including aggression or inattentiveness, may have a heritable component. However, bitches showing such behavior and their offspring should not be bred again. While anti-anxiety or serotonin enhancing drugs have been used in humans, their use in dogs should be extremely cautious since these drugs can pass into milk or the placenta, requiring hand rearing of pups. The key points for the summary of this case study is that the neonatal ingestion can mimic dystocia on radiographs. Radiography is invaluable for accurate fetal counting and identifying the malformations. Behavioral causes like post-whelping hysteria can lead to cannibalism, especially in stressed or inexperienced mothers. Stress reduction, proper calcium balance, and careful observation are key to safe whelping. Early recognition of these issues prevents unnecessary intervention and neonatal loss. These are the references of this case study, and this case study was based on research by Holmes, Maimon, and Fight from Washington State University with supporting reference from Beaver, Jackson, Johnston, and others. Thank you for listening.